Hello everyone, I'm Professor Lee of Dr. Anti-Aging and Herbal Medicine TV. Are you curious about your current telomere length? Measuring telomere length and seeing how much it changed after various telomere treatment is still being used in clinical practice. So today in part 3, I'll introduce several such testing methods. And in the next part 4, I'll talk about lifestyle habit, food and nutrients that help maintain telomere length. Let's get started. If you measure the length of telomeres using the DNA of white blood cell in the blood, the TTAGGG set is about 1,700 in newborns, and when you are in your 30s, it's shortened by about 30%, so the number of cells is about 1,250. Then, when you are in your 70s, it's shortened by more than 50%, so it's less than 800. Measuring the telomere length of each individual is not that difficult even now. Telomere length itself is not the only factors that determines lifespan. And another important point is that the speed at which length shortens is important, as well as the length itself. On average, adults lose 7 to 12 cells per year, but those who lose telomere quickly lose 2 to 5 times more. Therefore, when taking a telomere test for aging management, you should measure repeatedly over a certain period of time and evaluate the speed at which the length shortens. The first test method is the most commonly used in clinical practice because inexpensive and the procedure is simple. Have you heard of PCR test method used during the coronavirus outbreak? It's a test that uses the same principle and uses simple kit. Approximately 3 cc of blood is drawn to measure the telomeres in DNA of white blood cells. Then, the results are compared with the average telomere length of people of the same age, and the result can be received within 2 weeks. For example, the average telomere length of a 40-year-old man is 4.2, but if a 41-year-old man complaining of fatigue and decreased physical length has a telomere length of 3.1, isn't that shorter than the average? This suggests that aging is progressing rapidly. If any of you decide to slow down the aging process as your goal for this year and practice exercise, sleep, diet, and specific telomerase activators prescribed by a professional, you can take the test again after 6 months. And you can take it every 6 months to 1 year thereafter. If you are healthy but want to know about changes in telomere length, you can take the test every 1 to 2 years. In addition to this PCR test, there is also a test called the telomere fragment sudden blood that measures absolute telomere length, which is mainly used for research purposes. The second test method is also a test using the white blood cell or specific tissues called flow fish. It's used in clinical practice to analyze specific cell groups in patients with blood cancer such as leukemia or to evaluate the aging status of specific immune cells. As you can see in the picture, this part is the telomere part. This is a test method that attaches a piece of DNA probe that emits blue fluorescence that binds exactly to this part and analyze the length of fluorescent part using a cell analyzer. As you can see, the part that glows with fluorescence at the end of each chromosome is the telomere. By measuring the intensity of this fluorescence, the telomere length of each cell can be determined. For example, in the case of a person with a problem in immune function, by checking the telomere length of a specific immune cell, it is possible to determine how weakened the patient's immune function is. It is also used to evaluate how much the telomere length of cancer cells has decreased after administering the anti-cancer drug, inhibit telomerase in cancer cells to cancer patients. Aside from telomere length, we can also test how active the telomerase enzyme is. Blood or tissue is collected and tested. This is the original telomere part, and the white band arranged in steps above it are where telomerase works to create new telomeres. In patient 2 and 3, the telomerase actively repair the telomeres. That's why the white bands are clearly visible in succession. In patient 4, telomerase activity is maintained, but it's weak, so it's not repaired well, and the band part is faint. In patient 5, the telomeres are severely worn and faint, and telomerase activity is very low, so it is not repaired, so it is a case of severe aging. In actual clinical practice, it's mainly used to check the activity of telomerase in cancer cells or to evaluate the aging status of a patient. Regarding telomere length, a summary of 36 studies on 36,000 people shows that, although there are differences among people, telomeres are the longest at birth, and during the first few years after birth, cell division occurs rapidly and growth occurs, so the rate of telomere length reduction is the fastest throughout life. After that, telomere length decreases rapidly during the growth period of adolescence due to active cell division. At this time, telomeres are inevitable to shorten because cell division is necessary for growth anyway. However, telomere management is necessary from the age of 30. The key to telomere management in adulthood and middle age is to practice preventive methods to minimize damage. However, preventive methods alone are not enough in old age when telomeres are significantly shortened. More active management is necessary to protect shortened telomeres and to strengthen telomerase activity in adult stem cells. Immune cell management is especially important. Excluding germ cells, immune cells are the cells that maintain telomerase activity to some extent, even in adults. We need to actively manage the telomeres of immune cells to prevent immune senescence. We will study this in the next first lecture. Stay healthy, everyone, and I'll see you again in the next lecture.